Awesome. Okay, so my group and I today we are going to be discussing the gracilis muscle. It is a muscle in the lower limb found in the quad. Um, yeah. So here's the next slide. Um, so the muscle anatomy um, and attachments to the gracilis in relation to the pectineus. So the reason why I'm comparing these two is because gracilis and pectinus tend to get mixed up a lot of the times because they're so close in proximity. But there's some fine differences within those two muscles, starting with the origin and insertions. So for the gracilis, the insertion or the origin, excuse me, is going to be the anterior aspect of the pubis. So as you can see in this first picture here to the right, it's going to connect to that front side of the pubis, and then it'll run all the way down to that medial surface area of the tibia. And then as for the pectineus, this is where it's different because the origin is the superior pubic ramus of the pelvic, so just the top of the pubis, and then um, it runs to the posterior of the femur, the upper femur. So there's just a little difference there between those two. As for the muscle actions for the gracilis, looking at the concentric movement, you're going to see a acceleration of adduction. So the legs will be moving towards the midline of their body. So we also see flexion and internal rotation with the gracilis. That's what it assists with. Um, this is all happening at the acetibular femoral articulation. So this is just the hip joint. Um, and then for the eccentric movements, it helps decelerate uh, acetibular femoral extension, abduction, and external rotation. And then as for the isometric, um, this just helps stabilize the pelvis region along with the knee. And then so taking a look at what the gracilis helps with is essentially stabilizing that pelvis area, pelvis area, and also helps support that knee because it does cross both the hip and knee joint. Um, and we also see knee valgus if there's like weakened gracilis muscle because of that crossing of that knee joint. And then the next one that I have is just the antagonist. This is just going to be the tensor fascia lati, and that's just the lateral aspect of your hip, um, along with your gluteus maximus, medius, and quadriceps. The quadriceps is an antagonist because the gracilis does assist with knee flexion, and the quadricep, specifically the quadricep bicep femoris, is going to help with extension. So that would be an antagonist.
All right, this is me now. All right, so to measure the extensibility of the gracilis, for the joint radius test, I picked the hip abduction with the knee extended, as shown on the with the picture on the right. For the test position, the patient would preferably be in the supine position or laying on their back. Their pelvis should be stabilized to prevent any tilt to not mess up test. And then for their test leg, their knee should be fully extended and their hip will be moved into abduction. And then for why this works, if you were to do this test with their knee flexed, it would reduce tension on the gracilis and underestimate its tightness. Next slide. All right, so gracilis manual muscle test. To test the gracilis with the manual muscle test, you would position the position again in the supine position with their hip slightly flexed and abducted and the knee flexed. Um, the examiner would stabilize the pelvis and apply resistance laterally at the medial thigh, so like the anterior portion of the thigh, opposing hip abduction, while the patient attempts to adduct the hip, and you kind of see it in the picture below. Next slide. All right. Isolated lengthening exercise. The one that I chose was a standing side lunge with the straight knee. You would stand with your feet wide apart, shift weight to one side while keeping the opposite leg completely straight, and the toes are facing forward. If you could press play on that video, it might show it a little bit. Very simple, but it'll help the gracilis. All right, you can go next slide. All right, isolated activating exercise. I chose the side lying hip adduction with the knee flexed. For the positioning, the client should be laying on their side with the test leg at the bottom, and the top leg will be placed in front for support. The movement you would lift the bottom leg up and knee flex, and you can play the video for a better representation. Yeah, very simple. Next slide. All right, for the functional activity, I chose a soccer penalty kick. The stance leg would use the gracilis for stabilization. The kicking leg the kicking leg uses the gracilis to bring the leg inward. It would control knee flexion, and it would internally rotate the tibia to contact the ball with the medial portion of the foot. And you can play the video, kind of see it. But yeah, there we go.
All right, so a common injury to the gracilis would be a strain or a tear. This would happen in eccentric contraction, and with a strain or a tear, the impaired movements would be hip adduction, internal rotation, and knee extension. And two higher level questions to ask are during a soccer penalty kick, the stance leg relies on the gracilis for stability. Which role of the gracilis is most important during this phase? A, producing powerful hip flexion to drive the kicking motion. B, eccentrically decelerating hip extension and external rotation. C, isometrically stabilizing the pelvis and medial knee. Or D, concentric knee extension to lock the stance leg. And then the second question is a client demonstrates limited hip abduction when tested supine with the knee extended. Which functional problem is most likely if this limitation is not addressed? A, increased ankle pronation during gait. B, reduced pelvic stability and increased medial knee stress. C, excessive hip flexion during running. Or D, decreased quadriceps activation during squatting. And the answer to number one is C. And then the answer to number two is B. And that's all we have.
Awesome.